My name's Loretta Tkachuk, and today I'm going to talk to you about suicide. I'm from West Coast University. The first thing I want to talk about suicide is that it is the second leading cause of death for young people among the ages of 15 to 24 years old, per the CDC. On an average, there are 129 suicides per day, which 25 attempts are made for every completed suicide that happens. The incidence of suicide is 3.5 times greater in men than women. Certain risk factors come into play when we're talking about suicide. And when we're talking about the younger people, most of the time, there's something going on that causes them to have certain risk factors for suicide. For instance, individuals could have psychiatric disorders that aren't quite yet diagnosed by a physician or a psychiatrist. There might be something going on within the family, like a parental loss, sibling loss, or there's substance abuse going on. Nowadays, a lot of times, it's actually the social things going on with the younger people, such as bullying, or trying to fit in with peer pressure, or they isolate themselves. The environment can also have an impact as a risk factor as well, when there is easy access to firearms or medications that they can overdose on. The person who commits suicide, they die once. That's it. But those people that left behind that love them so much, they die 1,000 deaths. What's on your mind? The single most significant suicide factor is the presence of an active mental disorder, per Huckenberry. About 95% of those who die from a suicide attempt have a psychological disorder or a physiological disorder. From 2008 to 2016, there has been a great increase in suicide deaths, from 8.3% to 12.8%, and those are from those suffering from mental health issues. What can we do to help? Well, with family, the first thing is to have positive, open communication. With cohesiveness, it's crucial with mental health awareness. Relationships problems often develop feelings of being a burden or anxiety. So instead of being focused on having problems, try and talk through them. Substance abuse continues to have a direct correlation with suicide, such as suicidal ideation or suicide attempt. So it's important to try and keep substance abuse away. The second leading contributor risk factor that is compared to relationship problems is substance abuse. Social aspects or risk factors is media is imposing a great impact on our young people today by showing examples of actors and actresses and models whom teenagers are trying to copy or they see as an idol. Bullying has been on the rise along with the risk of suicide from bullying. Teenagers are not being educated on how to communicate and deal with feelings from those who are bullying them. There are various internal or external stressors to comply with the social norm, which imposes an imbalance in mental function. Increased pressure to adhere to social norms is also a social aspect too. So they feel this great pressure that they need to fit in with everybody else. And that's not necessarily true. Each person is their own individual person. The environment. Firearm use is known, and unknown mental suicide ideation continues to be the #1 method of choice. All firearms in the house should be kept in a safe under lock and key. Overdose is another common method for suicide. This includes over-the-counter prescription medications, and all these medications should be monitored closely. So an adult should be taking and assuming responsibility over medications, keeping them in one place, to know the provider's role. Safety first. That's the most important thing. Making sure the patients are safe, the families are safe, and the staff is safe. Proper psychosocial evaluation, such as implementing the mnemonic SLAP, specifically, lethally, accessibility, and proximity. Proper management of secondary conditions, because maybe they have something else going on that's underlining that can cause them want to commit suicide. Be involved by participating in mental health fairs or community awareness of mental illness and suicides. We need to make it more known, more education provided to everyone, so there is knowledge on what to do, not just as it happens and it's told over media and then in little groups. Holistic approach to care with involving all disciplines and family therapy as well. So ensuring that the person is getting exactly what they need, because maybe it's more than just the patient themselves. Maybe the whole family needs therapy so that they have a mediator to talk about and feel comfortable talking about problems that they have with each other. Work in collaboration with other interdisciplinary members and assisting with relieving secondary risk factors. So there's a crisis mode that goes on, and you usually can see some of the warning signs, even though we may just brush them off or ignore them. We shouldn't. So the first thing that happens is people start isolating themselves or withdrawing themselves from other, and they start feeling like they're a burden to everyone. They feel trapped. They start feeling anxiety. You notice that they're starting to use substances more, and they have extreme mood changes. So they'll go from being happy, la la la, 1 minute to all of a sudden, the world is ending. Increased anger, everything makes them mad, expressing hopelessness. And then there's a verbalization and making plans of suicide. They either post it or talk about it to someone. Speaking out about it or posting it and wanting to die. We need to take it seriously. The healing must start. And how do we start healing these people? The first thing we have to do is know the warning signs and recognize that they have the warning signs and keep everything safe and effective with management of the care. Most importantly, we don't need to blow off any little sign. Development of positive, open communication patterns. That's what their psychiatrist, their family, letting them be able to say how they feel openly, without judgment. It helps them to talk through what they're going through, and then they don't feel as such a burden. Myth and facts about suicide. Suicide only affects people with a mental health condition. No. Many individuals that live with mental illness are not affected by suicide. According to the CDC, about 54% of those who commit suicide are unaware of any mental disorder. Talking about suicide will lead to and encourage suicide. No, that's just a stigma. The more you talk, the more the person feels like someone's there to listen and someone has their back. So you need to talk about it. It does not need to be shoved under the rug. If suicidal youth tells a friend, the friend will access help. Most young adults will tell a parent when they are feeling suicidal. Most suicide occurs during the holidays, such as Christmas or Thanksgiving. No, because that's when family is surrounding, people are taking time off work and spending time with each other, and there's loving feelings around the holidays. Most of the time, suicide happens more in the springtime. And the biggest thing to remember is that when you're feeling these ideations of suicide, you are not alone. There are many things that can help and people that are there. There's a 1-800 prevention suicide telephone line that you can call, and it involves everybody. There's always a walk-in clinic in Victorville, California, where you can walk in and talk to someone when you're having this problem. And talk, get it out. And here are the references. And I want to thank you for taking the time to listen to this promotion about suicide and how we need to stop it or prevent it from happening just by taking time and listening and helping these people work through their feelings. That's the only way that we're going to get through it. Have a good day.